This segment is sponsored by Family Healthcare. When you're heading back to school, sometimes you're heading into the germ-infested waters of the unknown. Now that sounds kind of harsh, but schools can be a breeding ground for spreading illnesses. That's why I'm here with our friends from Family Healthcare to find out how they keep kids in the classroom and out of those sick beds. Steve, thank you so much for having me here today.
Hey, it's great to be here.
Absolutely. So we're at White Cloud Middle School, and you are the physician's assistant here. Can you talk to me about this program and what you do?
It's a great program. We're a medical provider office in the school, and so we provide medical care for the kids within the school, but also outside the school that can get here.
What I love is that you act as role models and mentors for the students. You're not just, their care providers.
Yeah, we're on their turf, so it's interesting. I've worked in a regular office for years, and here it's different. I think we're in the same place there, so it's not like we're in another doctor's office somewhere else. This strange person, but we're living with them. And so they come in, we're able to interact with them more. We try to be a mentor for them. We try to help them learn how to deal with health issues, learn how to navigate the healthcare system. So when they're younger, they're having trouble. By the time they're graduating, they seem to be doing much better there. But trying to teach them how to take care of themselves, but really showing them so much their value as a person, individual, respecting them, showing them respect, and how they can respect other people too is a big part of what we do.
Absolutely, and I know that you do a lot to kind of bridge that gap between young students and rural healthcare communities. You kind of give them a sense of understanding in the medical field.
Yes, medical field can be very confusing, very complicated, so we try to make that simple, try to be able to answer their questions at their level, and use the words and the language that will get through to them.
Wonderful. And what specifically do you have here? Because I know you're kind of a one-stop shop for all of your healthcare needs.
We have a lot. I mean, we have a medical provider, we have behavioral therapy, we have a dental that comes in here. We do some lab, but we have to send the x-ray and some of the lab off-site. But we provide pretty much everything, immunizations. It's really a full-service provider office right in the school.
We must have some healthy kids here. I'm going to bring in Carol. Carol, you are the program supervisor?
Yes, I am.
Wonderful. So can you talk me through the process? What goes into a kid coming in, they're not feeling so hot, they come see you. What's the process here?
Well, they do. The teachers, we have a great relationship with the school. The teachers let them out of the classroom because they know if they come here, we'll probably send them back. Because if a parent has to leave work or come and pick up the child misses a whole day of school and the parent misses a whole day of work. The parent signs a consent so we can see the child on their own. We always call the parent afterwards and let them know, hey, your child was here, they had an upset stomach or something to that effect, and we send them back. Gave them some medication.
Wonderful. And you have a 90% rate of sending kids back into the classroom. They might not love it, but I'm sure their grades and their parents and their teachers really do appreciate it.
Yes, they do. That's one of the selling points. When the state allocated monies for these centers throughout the state about 30 years ago, we hopped on board, Family Healthcare did, and we opened one of the first ones in the state. And it's been a great relationship with the schools that we're with.
Thank you again so much for having me in today. For more information on Family Healthcare, you can head to our website. We've got all the info for you online at wzzm13.com.